Canadian researchers are getting a first look at just how many people in our country have actually been infected by COVID-19. The simple answer, not many. The new study suggests less than 1% of Canadians have been infected. The results were released by Canadian Blood Services and Canada's COVID-19 Immunity Task Force. The data comes from 10,000 different blood donor samples. One of the researchers involved says the data reveals a vast majority of Canadians are still vulnerable. The findings will be updated when the full sample of those donations can be analyzed. For more on this, Timothy Evans is my guest, the executive director of the COVID-19 Immunity Task Force. He's also a professor with McGill University in Montreal. Good to have you back, Tim. Thanks for taking some time for us today.
Thanks very much, Todd. Great to be with you.
The significance of that, 1%.
Well, I think it's a reflection of the bigger picture in Canada, which has been, on the whole, a very positive story with respect to not letting the first wave of infection get out of control. And so Canada, in many respects, has been quite successful in flattening the curve. And I think these results from the 10,000 blood donors with respect to the level of antibodies confirms what we're seeing with respect to the numbers that have been detected through the tests by swab.
With an infection rate of under 1%, how do you think that potentially plays out in terms of a second wave?
I think, the unfortunate reality is that we are nowhere close to herd immunity. And so with so many Canadians still having had no exposure to the virus, with a second wave of infection, the virus essentially has 99% of Canadians to pick on. And so we have to we're very vulnerable with respect to a second wave of infection.
And also the findings here, how do they factor into the development potentially of a vaccine as well?
Well, first, the findings indicate that we don't have a high level of prevalence of people that have antibodies. And so if there is a vaccine that's effective, of course, it will be in high demand. The second issue on that is that we still don't know whether, in fact, people who have developed antibodies are going to be protected from infection. And so I think in that setting, the importance of a vaccine can't be understated.
I'm also curious as well, you talked about this being a good trajectory for our country. We're seeing clusters as well, but they remain quite localized, correct?
Yes, and I think one of the things to remember with respect to blood donors is that we're not seeing the full picture of infection in the country. Blood donors tend to be a little bit healthier, and they were actively screened by Canadian Blood Services if they'd had symptoms of COVID in the last 2 weeks. So this may be on the lower end of an estimate of the level of infection, and it's sure that in some communities and constituencies or people who have a lot of exposure to the virus, like healthcare workers, that will see higher levels of infection as determined by antibody tests.
Wonderful to have you on, Timothy. Thanks for taking a bit of time for us today.
Thank you very much, Todd. All the best.